I'm so excited to talk to you.
I'm excited too.
Wait.
I cannot wait to do it either. You're amazing. You're a legend. I'm super excited.
So, it's very funny. I, I was just having like an overall longevity exam, checking everything, seeing where I am at 79 versus whatever. And of course, I'm a big believer, not of course, but I'm a big believer if you can have estrogen in some format that is appropriate for you, do it, right? And so I've had an HRT patch since I was 46. And I had no idea the benefits I was getting from it because it kept evolving. I got a better version of it. And I just always felt like, cool, like good. I didn't think it was the patch. I didn't know what, I thought it was just me being fabulous, but no. And then I really got into saunas, infrared saunas lately a lot. And so I went through a period where I had a virus and I was going to get that virus and I was going to infrared it out of my body. And I was doing saunas every day, but I did not realize that my patch was drying up. And for the first time, I realized and learned of the devastating effects of not having any estrogen, by the way. So nobody could figure out what was happening. My blood pressure was spiking. I always had low blood pressure. All of this stuff was happening. Finally, my acupuncture doctor said, you've had every test. Why don't you get a hormone test? See where your hormone levels are at. 0.
Oh.
0. I was a shit show mess. And I'm starting this conversation with my personal experience to say, no shit, this is a major topic. And I'm so happy, that I'm having it with you because you really have a lot of good information. So why don't you tell us what is the most, first of all the introductions about you will have already been done.
Okay.
But why don't you tell us the most up-to-date information that you can report about hormone therapy of any kind?
Okay. Just in general? Is it?
Or it's up to you. Like what like the hottest news to inspire interest in this topic, because I think the goal for me here is for all the women I know that are and intelligent women who are suffering through discomfort they don't even realize they've gotten used to after the last 10, 15 years. This is our job.
Yeah.
Bring in the light, and you are bringing in the light.
Okay. That sounds awesome. I mean, there's not anything new like this week, but I think just even over the last few decades, we've continued to learn, but the public hasn't continued to learn and doctors haven't learned. So I think that there's knowledge, but it hasn't been disseminated out into the rest of the periphery about the benefits of these hormones.
So I think one of the things that I'm aware of for friends and I know obviously a lot of women because of my business that are in their 30s, 40s, 50s and beyond, that up to 50s are not aware of the fact that they are experiencing this hormonal change and getting used to it, right?
Yeah.
And so how would you present that conversation and trying to bring awareness about that?
Hormonal shifts like perimenopause can start as early as 35 and still be considered normal. So this is not something that we just start thinking about at 50, because at 35 and sometimes even earlier, we start seeing this kind of slow decline in estrogen and progesterone. And it just goes down, down, down. And then eventually closer to 50, it just kind of falls off a cliff. And so I think that as women, we should start thinking about, check your hormones and see your doctor early, and then make sure that you have a plan for how to get through perimenopause and menopause. And I think one of the key things is, as women, it's not just about preventing suffering during that time period. Like certainly there's hot flashes and night sweats and bone pain and all these things, but because women are pretty good at suffering. And I hear this every day, like, I'll just suffer through it, but It's not about the suffering, although that's important. It's about preventing the osteoporosis, the dementia, the sarcopenia, which is muscle loss, the frailty, all the things that come with age that estrogen, especially, but also progesterone and testosterone are so good at preventing. So you have to start that process early to get the full benefits.
Yeah, I definitely think, women starting with, our puberty years, go through this shock. All I can remember is, I think it was I was 12 or 13, and it was just not my happiest years. I don't think there's a woman alive who remembers that as their prettiest years. It's like, not pretty, not feeling good about yourself. Who the hell am I? And going through this incredible change, and nobody ever telling us this is what's happening. And it's sort of like the reverse menopause. It is a shocking a revelation for your body and your mind. And I think it starts there, and then through all of the waves and the roller coaster of whether you're having children, how many, trying to have children, all of that is so natural to women that, like you said, it's just, well, that's what we go through. But when do you think the first kind of appointment with a doctor to say, I want to have my hormones checked? Like, they're not going to be volunteered, as we know.
Yeah.
When do you say that? And I think it doesn't have to be a gynecologist. I think it could be any doctor.
Yeah, absolutely. It can be any doctor who understands hormones. And, we think that the gynecologists have kind of, will understand this, but they aren't trained any more than any other doctor in hormones. So it can be any doctor that knows these things, when you're still having cycles. So if you're, 35, 40, 45, you can check hormones. The problem is, because they're going up and down throughout the month, the hormone levels don't actually tell you as much as the symptoms. So sitting down for 30 minutes and just listening to the woman, like making, how are you feeling? How are your cycles? How's your energy, your sleep? The symptoms are more important. The hormone levels can be additive. There are some things you can check that can be helpful. So I think, somewhere in that 35 to 40 year range, you should develop a relationship with a provider who understands hormones, can do the appropriate tests or not, but at least listen to you. And then as you get closer towards 45, 50, you have a game plan in terms of, are you going to replace the hormones? Are you not? What else are the other options? That's the main thing is being offered the options. I think women in general, a lot of times just aren't given options. Like doctors are so used to telling women, here's what you do. And they don't think that women can think for themselves in a lot of ways. And so I want to change that, that narrative. Like, women actually can make good choices. We just have to give them the options to do that.
You mentioned, dementia, and, I do meet with and do podcasts with doctors that I feel educate us. And in my exploration and meeting doctors, the revelation to me when I first heard about the disproportionate amount of women with Alzheimer's to men was like, whoa, wait a minute. What is that about? And it's a number of things. Women maybe outlive men, but the fact that the lack of estrogen could possibly have something to do with it is real evidence. I think that some of the symptoms women feel is that they're losing their minds, right? That's a phrase that you actually hear, and that it's real. And, I remember when my mother was in her late 80s and she was going through a really difficult time, and her personality, everything had just gone crazy. And I was taking, hormone therapy for myself for the first time. And I asked her doctor if he would consider giving her hormone therapy. Dr. Kamali here. All I know is I felt good and I felt bad for my mother. And he said, you know what? Why not? What do we have to lose? And he did.
Wow.
And my mother and I had the best relationship of our entire lives together that last 4 years. She turned out to be a very funny woman who absolutely was so much fun to be with. I mean, she was always incredibly talented, but I thought, you know what? I have respect for this. And so I think just the idea that you don't lose your mind.
Yeah.
For any woman of any age, whether it's the emotional kind of description of women, which is very condescending. However, there is some truth to it when we are feeling outside of ourselves, like we're losing our minds or going through that. I think is enough of a curiosity. What do you know about that? What kind of experience can you share with us?
Yeah, I mean, the studies on dementia and estrogen are kind of, there's a couple of different, there's pros and there's cons according to the studies. But I think that the main thing is because in some of the studies that showed that estrogen wasn't good for the brain, they were starting it very late and they were using an oral synthetic estrogen. And that is not something that we want to do. So you do want to start it early. You want to use a bioidentical estrogen, estradiol, and start it early. But we know that as women go through perimenopause and menopause, there's a great book by Laura Moscoti. You probably read it, called The Menopause Brain, but where they have MRI images now, and it shows that the brain activity, the energy to the brain goes down by 30% during that transition, of, essentially premenopause to menopause. And so we know that estrogen is one of the key reasons, loss of estrogen, that happens. And so, there's a lot of evidence that giving estrogen early in the right way does help to preserve the brain. We have to kind of do some more studies just to make sure this becomes widely known. But I think absolutely. I think that it's so important for brain health. Women talk about losing their mind. Commonly, they talk about having, body pain, like joint pain, like I'm waking up and I'm hurting all over, like it's not even one spot. And we now know that there's a musculoskeletal syndrome of menopause. It's not just the bones that get weak. It's the muscles, the tendons, the joints, like everything kind of starts to fall apart when you lose estrogen. So that's why we wake up so achy and in pain as we start to get older, if we're not replacing those hormones. So it is the brain, but it's also the muscles and the heart and, the whole system. So.
Yeah. I really, again, back to the infrared sauna, drying up my patches. I couldn't sleep, and I've never had a problem sleeping ever. I couldn't sleep. I was having night sweats, and I did not associate it because I thought my patch was working. And I would wake up in physical pain as if I just did 2 marathons and like excessive weight training. And I was like, what the hell? And I really, really understood and forget about my mind. I thought, oh my God, I'm running a business here. I can't wait. I can't think. So I really recognized the effect is really all encompassing. It's just not getting rid of hot flashes. It's beyond that on such a big level of holistically taking over your body.
Yeah.
and so I think about how to get women's attention to consider the conversation. And I know we're so susceptible to how pretty we look, no matter how smart we are, whatever. We're in the carriage. They're telling us about how pretty we are. So we get it. And we're sometimes ruled by it, maybe more than we want to admit. But, so, and you can obviously talk on this, and this is a selfish request too, is, there's more and more conversation about using vaginal estrogen for face.
Mm-hmm.
And I think if women understood that there could actually be something that happens with that, I think they would be more open to understanding it, because we'll do anything. We'll put the toxic red from red lipstick on our lips if we think it's the right color.
Right.
And we will forget all of the other principles we have, right? But with this, I think that this is like a door opening possibility. And selfishly, I want to know all about it, because I'm about to take my vaginal estrogen and smush it all over my face.
So yeah, and that's fine. That's actually fine. So, estrogen for skin is important for keeping the collagen healthy and to keeping it in the structure that it's supposed to be. So when you lose estrogen, then the collagen starts to kind of collapse. Like think about a building, like losing its structure, it just kind of collapses. And so that is, a major driver of the change of structure, sagging of skin, as well as the loss of hydration. Loss of estrogen is very hydrating. And in some women, when you first start taking it, you actually have like water retention, and it can be a little bit annoying because you're like, oh, I'm retaining all this water. But it's actually a good thing, because if you don't have that water, you start to like become shriveled and like dehydrated. And this is what women, a lot of people, as you get older, that's what happens. Yeah. So the same thing with your skin. So your skin gets dry and it gets dehydrated. And part of the reason is because you don't have estrogen. So there are a couple of ways to solve it. One way is taking a systemic estrogen like you're doing, where you put a patch on, but it's a high enough dose that it goes throughout your entire body. And in theory is also helping your skin. And then you also can, if you want a little bit more on like your face, for instance, you can do a low dose estrogen, like a vaginal estrogen, which is at 0.1%. That's a very low dose. It just stays where you put it. So it doesn't go, like if you put it in your vagina, it doesn't go to the rest of your body. If you put it on your face, it just stays in your skin, your face. So you can do that for sure. There's some studies that have looked at just improving skin health, reducing wrinkles, increasing hydration, using that low dose estradiol on your skin. And it doesn't cause the rest of it. You don't have all the other benefits with it, but it does help the skin.
And have you seen that actually happen, or you've seen changes in the skin and the sort of elasticity? Like, is there real visual evidence of it?
Yes, although it's always hard, right? Because I'm usually doing, for both myself and patients, I'm usually doing multiple things at one time. I'm doing the creams, but we're also doing, 8 other things and some supplements and some lifestyle and things like that. Yeah. But there are studies for sure. And especially in the studies, it's mostly women who are not taking hormones systemically that they put it on their face, and they definitely see improvements. The question is, if you're already taking estrogen systemically, like, the patch or the pill, then if you add more to the skin of the face, does that help even more? I think probably, but it hasn't actually been studied yet.
Yeah, because 0.1 is pretty low in comparison to what a patch would be. But I will be trying it, so I'm excited about it. I think, I don't use anything. I don't use fillers or Botox or anything, mainly because I feel like the quality of my skin at 75 isn't substantial enough to deal with Botox or fillers properly. Like, it's not enough of a cover. And when I see people my age do it, it's like, oh my God, that's a lot going on there. And your skin can't maybe handle it. But I do like the idea of, if there is anything to kind of give it some, maybe hydration alone would be enough, if it just does that. So I will do a little testimony and
Yes. Well, I mean, you obviously have amazing skin and you look incredible. So I hope it helps, but we'll have to see.
I think it also, if it does, I think it's also the gateway to women then understanding that there is something to the benefits. What's the difference between the pill and the patch? What's your take on that, and how can you educate us about that?
So there's a couple of ways you can get your estradiol. Estradiol is the bioidentical form of estrogen. This is the one we like. You can get it through the skin, which is a patch, a cream, a gel, like anything like that. You can get it vaginally in higher doses where you put it in like a ring or a cream and it goes all the way throughout your whole body. Or you can take a pill, which is an estradiol pill. And like recently in the last few decades, most doctors have changed to recommending the transdermal because transdermal does not increase your blood clot risk at all. And so it's very safe when it comes to blood clot risk. I like transdermal, but I also like the oral estradiol, especially in younger women who are just starting menopause. Especially if they have like high cholesterol or high lipids, or risk for heart disease. So far, the only studies we have in estrogen that have shown reduction in coronary vascular disease or heart disease has been an oral form of estrogen. We don't have the studies yet to show us that the transdermal form is really that good at improving your lipids and reducing heart disease risk. It might be the transdermal is just as good, but it hasn't been studied in any large studies yet. So that's the only thing I think they're both great, but the oral estradiol can increase your blood clot risk slightly. I mean, it's much lower than the Premarin, which is a synthetic estrogen. Right. It's much lower than birth control pills. And no one even tells women that those are going to increase their blood clot risk. And so, yes, there's always a risk benefit, but I think that, transdermal is very safe. It's very good. It just hasn't been shown to reduce heart disease risk like oral.
So would you then say to a 35-year-old, start having your hormone levels checked? Would that be a point to start asking that question? I think had I known that and would be able to see how the dipping and up and down is happening, it would make us all, I mean, when are we going to have hormones on our, I think that I would like that to be happening. I think that would be amazing. But of course, we need a little bit more technology something to make that happen.
There are some, and I haven't tried them yet, but I just met some this weekend in New York. There are some companies that do salivary hormone testing in real time. So you're at home, you do the saliva swipe on your tongue, you put it in a little machine, and within 20 minutes, it gets you your estradiol or your progesterone level. It's a salivary level, and they sell the test kits where you can do as many, like a certain number of tests per month. So I think especially for people who are like either trying to work on fertility or in perimenopause and really don't know what the heck is going on, and just getting those trends in like those hormones could be really helpful.
Oh my God. I mean, that could have an incredible impact on a lot of political issues too, couldn't it?
Yeah, I think it could. I mean, if it's proven to work and be validated and all of those things, I think it gives back more power again to the women. They don't need their doctor as much. They could do things on their own. They can take the results in and say, "See, look, I'm not crazy. Like I'm not crazy. This is a hormonal problem that I'm having."
Wow. And so is this yet happening or is it on the horizon?
It's actually, I don't know the company name because I didn't write it down, but it's actually available. It's out there right now. I should know the name. I wish I did. Okay. I'll find out for you and let you know.
Yeah, I would like to see what it's about, because I think the more power we have over our bodies, the knowledge is just an incredible tool that women have been without. And obviously the more women that are involved in it, like you are, to help us, the better, and more of these tools, even better. What correlation, if any, do stem cells and estrogen have I'm always wondered about that.
Yeah. No one's ever asked me that question. That's a good question. Well, the stem cells, as you know, are the cells that keep all the other tissues, that, kind of help all the tissues stay there. Right. So replicate, do all the things. Certainly one of the reasons that stem cells and cells in general stop functioning is because of loss of hormones, because every cell in your body has estrogen receptors on it, testosterone, progesterone. So I haven't actually ever looked up the direct relationship, except that I know that estrogen affects every cell. And when you lose it, cells start to either die or they start to become these zombie cells, these senescent cells that we talk about. They can kind of set up shop, and then they can actually cause even more problems. So that I think that the stem cells definitely play, I do a lot of stem cell procedures as well. In my clinic, I do aesthetic procedures and other ones, and use stem cells. But I always tell people that before you do a procedure like that, you always want to get your hormones where they need to be, because the hormones are foundational. And then after, you can do crazy things and do fun stuff on top of it, peptides or stem cells or whatever. But your hormones really need to be the foundation that is stable before you can start adding other things on.
Yeah. And at what age, I guess birth is the best time to do stem cells? Tell us a little bit about what you're doing with stem cells. I just, like AI and all the technology that we have available, medicine probably is benefiting in such an incredible way. But the idea of stem cells in the future of medicine and where we are now is just so exciting. Talk a little bit about, first of all, how stem cells can be used, a little bit of the background, and then what you're doing and some thoughts about that.
Yeah, I totally agree with you. I think the stem cell therapies, these regenerative therapies, just kind of a whole class of them, are absolutely the future. And we can do some things now, and there's some that we can't do now. But the idea is giving you something, either a cell, either from your own body or from somewhere else, that then talks to your other cells and tells them, hey, we need to start repairing ourselves. We need to become younger. We need better blood flow. We need essentially repairing and regenerating. And so the stem cells, or their growth factors like exosomes, which are kind of the growth factors of stem cells, they're really just working by communicating with the cells in your body. There's these very good messengers. And so we can inject them, into different parts of your joints, your face, your scalp to regrow hair, your sexual organs. We can do various things like that, using either your own cells, which is the most common thing done in the US, or using placental stem cells, which is going to come from a full-term baby placenta donated after the baby's born. It's not a danger to the baby at all. We can use those cells, which are of course little baby, new cells, and they've got a lot of good potency. We can use those as well in the US. And then outside of the US, they're allowed to take those cells either from you or from an umbilical cord, and they can expand them by growing them in culture. So they can get more and more and more of those same cells, and then they can give them to you. So that's why people are moving out of the country to do some of those big, procedures. If you're trying to treat a systemic disease, treat your Alzheimer's, treat your MS, then they'll go, to Panama or the Bahamas. But in the US, we can still do stem cell procedures, but we just can't grow them out and make more and more of them.
So you can actually do stem cells from placenta, but not from the kind of generated placenta.
Correct. And we have to be careful in how we talk about it. We actually can't talk about using stem cells. We talk about using growth factors or cellular tissues.
Okay.
There's a lot of sort of things like that. Or we can use stem cells from the patient. So we can actually take your bone marrow stem cells, for example, and isolate the stem cells and then put them back somewhere else. Like if you needed to put them in a hip or your skin, we can do that as well.
Fascinating. Very exciting. When did you start getting involved in stem cell? What was the inspiration?
Yeah, I was an ER doctor first. So emergency medicine was my first career. I did that for about 10 years. And then towards the end of that, I had my 3 kids within 2 years, and it was just kind of madness.
Oh, wow.
I was just talk about losing your mind. I was, sleeping 3 hours a day, not exercising. I was just barely surviving. And I remember I went to the work one day, and I was kind of looking out at all these people waiting to be seen in the ER with all these chronic medical problems. Right. And it just kind of struck me all of a sudden that if I didn't do something to like change my life, to change my trajectory, that I was going to be one of those people in 5 years or 10 years with a chronic medical problem that could have been prevented, if there was education and the ability to do so. So that was when it started about 12 years ago. And I became interested in hormones and prevention. And then shortly after, regenerative medicine, because it all kind of goes together, in my thinking.
Very exciting. I mean, it really, everything you touched on is, I think when you think of preventative, you just change the power of the insurance companies, the power of where we are today with medicine, and make it accessible to everybody, which obviously is a dream everybody has. And I just love these areas of exploration. Hopefully that can change things. When you talk about integrative medicine, I remember, I think it was around mid-90s that I met Andrew Weil, and he would have these weekends, integrative weekends, and invite Michael Pollan and all of these amazing people to come talk. And I was really fascinated by thinking ahead and this kind of integrative medicine. And I would go, and there were all these doctors there, and I didn't know a lot of what the conversation was, but I took copious notes, and I was just enthralled with the idea of how medicine could be. And I thank him for really being an early teacher. And he really is a pioneer, as I'm sure everybody gives him great respect for doing, and opening up the idea of what mushrooms, or, Michael Pollan, all of those early books were really revolutionary. And I think integrative medicine had an identification then, but it's kind of really zoomed forward. We just talked about stem cell. And how would you describe integrative medicine today?
To me, it means really taking kind of the best of all different types of medicine. This is how I use the word, at least. So, taking the best of traditional medicine, because there's a lot of great stuff in traditional medicine, but also taking the best of, naturopathic medicine or holistic medicine, and the best of, maybe even Eastern medicine or other types of medicine, and bringing those things together, obviously looking at the evidence, looking at the risks and all that, but not limiting yourself to just one path and saying, I won't use pharmaceuticals, I'll only use this, or I won't use natural products, I'll only use pharmaceuticals. I think, I think both are closed-minded, and the way to actually stay healthy as long as possible is to use anything that works and that's safe, right? So that's kind of how I think about it.
Yeah, no, that's true. Balance is really everything in life. I'm assuming, obviously, with integrative. And I think now there's so much more open conversation about it, that even traditional medicine has an ear to options, and it makes it easier. I know that sleep is also part of the conversation. You are very informed and an informer of. Why don't you kind of give us a little history, a little background about sleep, and how you see it in the context of what you do as well?
Yeah, I think that it's like the rest of the nutrition and movement and stress management. It's one of those kind of 4 or 5 main pillars, community, that is really important. And I think, I realized how important sleep was when all those years, you kind of talked about how you're like the moment when you started feeling really bad, when you stopped the estrogen. I had a moment when I realized that I had spent 20 years not sleeping. And then when I switched out of the ER, because I'd worked all these crazy shifts, and I just got used to being tired, and I had no idea. And all of a sudden, I remember there was a couple of weeks where I was able to go to bed at a normal time and wake up 8 hours later. And then I, did that for a few weeks. And all of a sudden I was losing fat. Without trying, without dieting, I had more energy, I just realized that sleep was so important. So for me, and the way I talk to my patients, I think that sleep is probably more important than almost anything else. I think close friends, close relationships, and sleep. If I had to just choose two things, those are the two I'd focus on.
Mm-hmm.
And then certainly I would add some exercise and nutrition and all the other things in there. But I think that if you're not sleeping well, there is no way that your body is healing like it's supposed to, that it's repairing, it's recovering. And you can't build on that if you're not sleeping well.
Yeah. Yeah. I totally agree. But I think, sleep is just so difficult for so many people. And even for me, that period and this was months of not knowing what was going on. It got really bad. And I was delirious from not sleeping. And I don't take medication for anything unless it's like dire. And I refuse to kind of give in to any sleep help in that way. And I would meditate. I did every kind of meditation. I tried everything you could think of. I did so much research on sleep through the years that I sort of knew what the options, and dark, I tried every sound thing, and it was painful. And I had such sympathy for friends who have had a terrible time with sleep. And I also saw I saw myself fall apart, basically physically. Like you said, you lost weight. I was like gaining weight, and I was working out. I wasn't eating in a different way, but how am I gaining weight? Like I couldn't, what is happening? Everything is, why do people gain weight when they don't sleep?
It is just it's one of the, you have to be able to sleep to, recycle, to get your muscles strong, to get all the toxins out. Like there's a whole bunch of repair stuff that happens when you sleep. And so, yeah, we know that even if just a couple of weeks of not sleeping well, then you gain weight, and you also lose the ability to say no to foods that you might say no to otherwise. You're just tired. You're like, give me the donut. I'm too tired.
Right,
fight.
Right.
Like you lose the fight a little bit. You're also too tired to go to the gym. Like it's kind of like a cascade of things that happen. It ends up, you do kind of fall apart. I remember after I had my twins, and I was just a couple of weeks, out from having them, and I wasn't sleeping more than like 2 or 3 hours a night, but I decided I needed to go to the gym and like get back to shape. And so I went to like my Gold's Gym or something. I got a trainer, and I go into my trainer every week. And after a couple of weeks, I showed up, and she was like, Amy, you look horrible. Like, are you sleeping? Like, what's going on? And I was like, no, I'm just sleeping like 3 hours a day. Like, I don't have any. And she's like, what are you doing here? You need to be at home sleeping, because there's no amount of working out that's going to help you right now more than going and sleeping an extra hour. And I remember that was, she lost money on me by telling me that, but I remember that still to this day. Like, you can't outwork out or out eat, a poor sleep.
Yeah, no, it's true. And, the best, results in anything, especially if you have a cold or you have COVID or anything, sleep that's the best medicine of all, as much as you possibly can have. I also think, the good news about measuring is I noticed that, cause I'm fixated with understanding my sleep, right? How can I make it better? How do I get better quality? When I wake up in the morning, I wake up with so many ideas. I don't know where they come from, and I'm grateful to them. I feel like I have a fairy god designer and I wake up, I have a ton of ideas. So I never not want that to happen, but the idea of a quality sleep is always of interest. So I remember when I was having this whole thing with the estrogen, all kinds of medication was being recommended. So I was trying, and nobody knew it was estrogen yet at this point, because if you have high blood pressure, you're not going to check estrogen as the number one thing.
Right.
And so I was on all kinds of things. And so I would watch my sleep, and there was one medication that the quality of my sleep was so devastating. I took it for 2 weeks, and I finally said, first of all, I hate medicine. I hate all of this stuff. I don't think I should be taking it. I didn't know what it was, but then I just thought, what is going on? I'm looking at the measurement and the quality has dipped down to so low in watching what's happening with it. When I stopped, boom, everything went back to where it was. So if you think about the amount of things we do, whether it's medication or who knows what, that can affect your sleep, the quality of your sleep, that I love the idea of measuring. So at least we can do something about it.
Yeah. Yeah. I mean, it warns you when, kind of when you're getting sick, you're all of a sudden you see changes in your sleep, your temperature goes up or down a little bit. Like I think that these rings, as long as you don't get too obsessed with the outcome, I think that they can be really great tools for helping to really kind of optimize and make good choices and things like that.
Yeah. I think that's really the best. And the fact that I could see that was helpful in making a decision about, well, okay, maybe it is something else. And I think the more informed we are, absolutely, the better for us. What are your, best takeaways for everyone? Everybody is affected by some poor sleep situation, whether it's just in traveling or a period in your life or some trauma or something. What would be the best advice overall about considering new methods of having a good night's sleep?
I mean, there's so many little tricks and tools, obviously, like you said. I think some things people don't talk about a lot is meal timing and making sure that you're not eating in the, 3 or 4 hours before bed. And also making sure you're not drinking alcohol in those hours, which we know is very disruptive to sleep. But food, when you eat, your body has to kind of ramp up, it has to do something with the food and it's kind of gearing you up. But what you want is to go to sleep. And so it's really fighting against sleep to eat right before bed. And they've done studies and, people, they don't sleep as well when they eat before bed. And you see increases in your insulin. You see insulin resistance and high blood sugar and kind of prediabetes and things like that, high blood pressure, all of that just tied to when you eat your last meal of the day. So trying to back off and maybe it's hard because I love to go out to dinner and have a glass of wine and do all the things, right? But trying not to do that very often and have bigger meals in the middle of the day and maybe kind of smaller meals at night can actually improve your sleep for most people.
Oh, I totally agree. I cannot, as it is, I love more and more going to bed early and waking up early. So yes, but I love being with my friends too. And then the idea of, thank goodness, especially friends that work out and are into being healthy, it's 6 o'clock for dinner. Okay, that's good.
Yes, I'm the exact same way. I love to be done by 8 and then I can just be home and start my, the wind down is important too. Having a couple of hours if possible to, turn off your TV and get rid of the email and just make a cocoon for yourself and, warm baths, all that stuff actually does work also.
Yeah. Yeah. No, I totally agree. But I find more and more friends are as happy as I am to have an early dinner or even I even try to have, a heavier lunch than I would have and then something light, towards the evening or even when I go out to dinner, it's I really pick something light and not, a big thing. Tell me about alcohol and sleep and everything else, by the way.
Oh yeah, I have a love-hate relationship with alcohol. We know alcohol is a toxin. I mean, there's no debate at this point that it is there's nothing good about it. It is not good for you. And I say this as someone who does drink occasionally, but for sleep, it makes you drowsy. So you think it's helping you go to sleep. So it can make you kind of fall asleep faster. but it's actually going to be stimulating in the middle of the night. So, it's very common to wake up at 2 o'clock in the morning, after you've had a glass of wine or a few, because you've had that like deep kind of depressant effects, but then it ends up being stimulatory. And so it's actually quite disruptive to sleep. It's very bad for it. It is damaging to most of the cells in your body. Like, it is something that if we could get rid of alcohol, get rid of smoking, and get most people moving, we would have a much healthier society. But, it's also so closely tied to our social interactions and our social life. And so I understand why it's hard to give up, but it is definitely not good for us if we're asking that question.
Yeah. Yeah. For me, it's very interesting. For some reason, whenever I had alcohol of any kind, or even, I love the smell of Guinness Stout, but if I have a sip of it, I get my eyes tear, I start coughing. So I have this negative kind of reaction to alcohol. And so I don't drink, and I haven't. And I realized that when I'm with friends, I just don't say I don't drink. I just say I'll have something else tonight, because I realize that it is such a great social experiment. When I wrote my book, I wrote in it, if you can stop alcohol, now's the time to do it. And this was before these studies came out. The publisher, everybody, I think you got to take that out. Going to be a problem. And I said, no, I'm not going to take it out. But the thing that I wonder about, like, what are the components of alcohol? I mean, there's a tremendous amount of sugar, right, in alcohol. Is it the sugar, or is it the combination, or it's like, what is it it is sort of poisonous in a way. And to some people, it is actually poison, right? So
yeah.
It can be toxic to a lot of people. But
yeah, for sure.
Yeah. I think, unfortunately, we all go out to dinner now more than as a social experience. And years ago, you go out dancing, and no matter what age you would go out dancing first before dinner. And I remember when that switch took over, and like, oh no, I always counted on dancing to kind of keep me trim and not having to worry so much about what I'm eating. But I think that we are a social kind of society, and thank goodness for that, because social media could totally take over if we didn't go out to dinner and have a drink, right?
Yes.
So I feel you have so many great interests, and obviously longevity, and the kind of looking at longevity from your perspective. What are your thoughts about how we should approach a long, healthy life?
I've been thinking about this a lot. And I think that, I think obviously all the basic stuff is the most important, all the foundational things we already talked about, and all the, movement and community and all of those things, and then getting those, and just making sure that we pay attention to this. I think that as we're more and more on our phones and on our computers, and I'm guilty of this too, then we aren't as likely to go outside for a run on the trail or to go meet friends. And I think that, making sure that we're paying attention to those things is important. And then there's a lot of tools out there that are available now that most of them do require going through to your doctor, but that I do think can make a difference. It maybe not in lifespan yet, but at least in health span. And those are things like hormones, which you talked about, which I'm a huge fan of, as you know. But there's also a lot of, there's peptide therapies, which are just little, tiny little proteins that your body already makes that we can give you back in specific ways to just keep that kind of homeostasis going as you get older. And there's, there are ones for brain, there's ones for bone, known for, all different parts of the body that it can be really helpful. There are a number of medications that I think are interesting, even for someone like you who doesn't like drugs. We're using certain medications off label and in small doses, and seem to have a lot of system wide benefits. And, one example, for instance, is like the GLP-1s, like Ozempic, which you've heard about for weight loss. And there's a lot of people saying, that it's a bad medicine. But actually, if you look at the studies on it, there are so many studies showing that this medication in probably much smaller doses can benefit your entire body. And I think that this is probably like the longevity drug, or one of them that people will be talking about, for a decade to come, because of the way it's changed, not just our ability to lose weight, but also reducing heart disease and reducing kidney disease and all these other things, autoimmune disease, which is really important. So I think that, being open to some of these medications, maybe in different doses or small doses, is something to think about. I'm always up for trying new things on myself, regenerative medicine, of course, but ultimately, it always comes back to first nailing those foundational pieces. And if you can't do that, none of these hacks, or tricks or medicines are going to really move the needle.
I tried metformin for a while, because I agree. And I think there are a lot of benefits, and finding the right amount to take. I'm small, and compared to a man, I shouldn't take the same amount, and understanding that. But one of the challenges for me, and I'm a believer in those types of medications, and metformin has a value as well. But I found it very difficult, as it is as you get older, to develop muscle mass. And I'm basically a pescatarian who decided muscle mass has to be more important in my life. And so I've just started eating chicken since 1980. I haven't had any chicken.
Wow.
So I'm having my moments with that, but I understand that this is important. But I did a pause on metformin, and for further, exploration, I want to build my muscle mass back. And I know that this is a topic that you also have expertise on. Why don't you, talk a little bit about that and the importance and how to kind of look at that?
Well, first of all, I stopped metformin a few years ago for the exact same reason, because I'm also kind of thin, and I was like, my muscles are like they're not getting any bigger, even though I keep going to the gym. So I stopped it. I also don't do intermittent fasting for that same reason. I don't feel like I could go that long without eating, without breaking down my body. So I definitely think that individual, and I think for women, it's especially, again, after perimenopause, you have to think about not just your bone health, but your muscle health, because loss of estrogen also causes you to lose muscle. And so if you can take estrogen, take it, and testosterone if you need it. Not everyone does, but a lot of women do great things from testosterone. And then thinking about, obviously lifting heavy weights. I think as women, we're kind of, in the old days, we had like Jane Fonda and treadmills, and we would just do cardio for 2 hours, and that was how you did it. But trying to switch the thinking to actually, let's get to the gym, let's lift heavy weights, let's not do as much of that kind of like low level zone 2 kind of stuff is important, and really focus on building. And then also, if needed, you can also add other things that can help build muscle. There are growth hormone, there's growth hormone peptides that increase your own production. There's testosterone for women, which is fantastic. But I totally agree. And I think that it's interesting. There's this sort of longevity world, and but most of it is kind of dominated by men, and most of the studies are on men. It's all a bunch of men.
Male mice.
Male mice.
What is
male
this?
mice? Yeah, it's all men, male mice. And, as we know, it wasn't until like the last 20 years that women were even allowed to be in studies. Because we're so complicated. So I think that we do have to look at even the studies that have been done on drugs, and we have to say, okay, but was it done on women? And usually the answer is no. Or maybe there were like a couple of like token women, but for the most part, no. And we know from there are some mice studies now. It's these ITP studies in mice where they are starting to test these drugs for lifespan on both male and female mice.
It's
And we
about
have
time.
seen
It's
that
about
there are
time.
differences. There are
Yeah.
some drugs that work for men and from male mice, and they increase lifespan in male mice, but they do not
Right.
increase lifespan
Yeah.
in female mice. And there's a few of those now. So I think that getting more women interested in longevity, which is one of my passions, is
Yeah.
women's longevity, and then, you know, advocating for the studies and the science and the things that go with it, and not just taking from men and saying, okay, that probably works for me as well.
Yeah. And, you know, while I believe, I am so on this completely about the masculine interpretation of health. It's been driving me crazy for the longest time. It's like every time I read a study, it's like, it's a study for men. How do we interpret it? But I do think, weight training, I've always been, very, very adamant about flexibility and, having endurance in working out and using body as weight. And I did that for years, and I still do. I love yoga. I don't use Pilates machine, but Pilates mat and some other very, I don't know. Do you know Physique 57? It's sort of like Pilates on crack. It's
like a
very
mega
intense.
reformer kind of thing?
No, but it's not with machines. And so it's always served me well, and I'm flexible and I feel strong. But because of the metformin and because of my episode with estrogen, it's like this was a big awakening. The importance for my strength became a really big focus for me, because if I feel strong, I don't feel old.
Mm-hmm.
If I feel strong, I feel like I can do anything. So physical strength is really important for me. And in this company, if you don't have physical strength, this is for everybody that's here. We are a physical group. We're moving fabric rolls. We're moving mannequin. We're doing this. And so am I. And I was feeling like I didn't have the same kind of energy, and it really disturbed me. So by stopping metformin, taking a pause on it, because I believe in it. I believe in the idea of it.
Yeah.
But I also believe in muscle strength. And so I've been doing a combination of things, from some Chinese exercises that don't use weights, but have a different kind of energy that I've never done before, that helps with posture, which is another thing to think about. But I love weights, and I love the accomplishment of building up to something, right?
Yeah.
And doing things with the weights, is really, really helpful. But the takeaway is that I wake up in the morning and I feel like I can lift anything. Like I feel very powerful. I feel like my shoulders feel like I can carry there are symbolic things.
Yeah.
So when did you start doing weight training?
I mean, I was an athlete in high school. So, I mean, it was, I started in like junior high. It was, I've been weight training on and off my entire life, even though I don't look like it. I'm still pretty scrawny, but it's always been something that I integrated in some way, whether it's yoga. I love yoga also. And or actual just kind of weightlifting. But I think that also the other thing that you said that was important is you talked about your flexibility and posture, and then balance is also something that we don't talk about too much. But as you get older, especially the reason you break a hip is because you fell. And the reason you fell is because your balance is not as good. Your strength is not as good. Your proprioception, the way that your brain talks to your muscles in your body, and your balance. And that's something also that I think is really important to work on, whether it's with yoga or, just, different exercises like that. My mom, who's in her mid 70s, a year ago, she fell at the track. She was actually working out at the gym. She fell at the track. She was walking, hit it like a lip. She fell and she broke her hip. And she had been taking estrogen because I had put her on it. I'd had her on it for 10 years, but unfortunately she had had 15 years before that where she wasn't taking it because her doctors had stopped it after the 2002 study. Anyway, she broke her hip. She goes to the hospital. She gets it repaired. She gets sent home. And as she's getting sent home, the doctor sees her prescriptions and the doctor is like, estrogen. And he marks it out. And he's like, you don't need this anymore.
No.
And he sends her home without estrogen.
No.
And so my poor mom, and you could appreciate this, she had been taking it for 10 years. She had liked it. And now she has a broken hip.
No.
She literally can't even get to the bathroom by herself because she has a walker and she's in pain. And now she's having to urinate all the time because you have urinary incontinence when you have no estrogen. And she has no strength and she's waking up at night multiple times at night and she's having hot flashes and she feels like she's losing her mind. And it was because of the estrogen. And so luckily, I put her back on it after a few weeks when I realized it. But I just think that there's this lack of knowledge about, the importance of these hormones. And then also making sure that you have the balance so you don't trip and you fall when you're at the track. Like you can just stumble, but not actually fall over is really important too.
Yeah. I personally, I will say that through years, and I work out just about every day, it's very important for me. I feel so good, no matter what the quality of the workout is that I'm making, I'm doing that. But what I see, and this is someone who's consistently working out, when I sweat the most is when I'm doing balance now. And I've been doing balance look at all the exercises that I've been doing through the years. And I have to really focus and put a lot of energy into balance because it just is not something that gets better with age. It becomes more challenging and, which makes me feel I need to work on it every day. And the balance, when I am really pushing balance, the sweat just pours out of me because the energy and the effort to do it. And I think that never used to happen before, but, I really focus on that. And I think it's something every woman should do, especially because our bones are more fragile. They are going to get fragile. It depends on how fragile they get. But, the other thing about, and this is for anybody listening that, because I do have a young audience too, is that for your moms or grandparents, I wear glasses and I have Verilux lenses, right? So even though I feel like my balance is in check, just the glasses of going up and down, or if I'm walking without my glasses, the distance, and everybody who's wearing glasses knows this, the distance in itself is sort of concerning. So when I go up and down steps, I have to really pay attention. And I'm someone that runs down steps, right? It's like, but I have to pay attention because just doing this is enough to throw off. So, and a lot of people are falling. I mean, it's just we're not paying as much attention. We're looking at our phones.
That's true.
And, but having muscle to kind of be able to, kind of straighten up or control or have balance. The more weight training I'm doing, the less sweating I'm doing when I'm doing balance. So that's also one of the benefits of muscle. So are you thinking that you'll think about drugs like metformin after you build muscle or like get to a point? What is the solution for that?
Well, my thinking is evolving, first of all. I mean, right now I take dihydroberberine, which is it's berberine. And so it's similar to metformin in a lot of the mechanisms, but it doesn't have the same effect on muscle. So I take that every day. I have a supplement company and it's in that. But there's like a recent study with metformin on monkey brains and how it really helped to prevent the aging of the monkey brain. And monkeys are pretty similar to us. So I like the idea of metformin. And it depends on who you talk to. Some of the experts, in metformin, they say, yes, it could affect the way that your muscle building, like the hypertrophy, the ability to build like a lot of actual muscle, but it shouldn't affect the strength of the muscle. This is what some of this, like Nir Barzilai says this, that the studies show that your strength is not affected, but the actual amount of muscle you build is. But I think it's very much dependent on the person. Like your story, if you're taking it and you're noticing that it's actually changing either how much muscle you're building or how strong you are, then I do think it's probably not worth it. Whereas if you are a guy with a ton of muscle and, maybe losing a little bit of muscle is not a big deal. And it's beneficial because it helps with your blood sugar and your inflammation and your brain and all these other things.
I think it's great. I interviewed Nir about probably 8 years ago.
Oh, yeah.
And it was very funny because, I knew somebody that knew him and they said, you really should meet this man. And he started talking about metformin and I said, are you taking that? And, it fell way ahead of the conversation.
Yeah.
And he said, yes, I'm taking it. And I thought, oh, wow. And it stayed in my mind. And I thought, I really find this fascinating. But I thought, why would I want to take a diabetes drug? Like, why would I want to do that?
Yeah.
And then, obviously he had done some incredible research and he's a great guy. He is.
I like him a lot.
I like him so much.
Yeah.
And I believe in it. I believe in the premise and I tell people about it who want to think about doing something like that. But it's very personal. And when you lose, on any of these drugs, when you lose muscle and not fat, it's an unhappy. So everybody has to find their way with how to do it. But I do think I want to preserve my brain and body and everything else. So how do you not get the benefits of this great discovery, the byproduct of other things?
I mean, there are at this point, a lot of the drugs that are being talked about they were diabetes drugs, but now they're being repurposed into, we're seeing there's like 3 or 4 different drug classes, not just metformin, there's SGLT2s, a diabetes drug, which doesn't cause muscle wasting, as well as the GLP-1s, which we talked about, like the Ozempics. So there's this whole, there's several different drugs, all of which are diabetes drugs, or most of them, that all seem to affect multiple organ systems in a good way. And so I'm hopeful that some of those become more studied, don't cause muscle wasting, don't cause muscle loss, and don't have the and metformin has a lot of side effects too. Metformin, as you know, it upsets your stomach. Like you're like either having, usually when you first start taking it, you're just like, oh, whose idea was this? It usually gets better with time, but it can be a tough drug to start.
No, I mean, it's other than just getting used to it. And I'm not a drug person, but because I believe in, looking at longevity and aging with power is my motto. I thought this is really a great move. This is a great opportunity. And, I'm sure the other choices will come soon. Tell me, what you think about, NAD and any of the, therapies that are also part of the longevity.
I have mixed feelings. So I think that some of those things are great. Like I love spermidine. I love dihydroberberine. I think some of the NAD precursors like NR or NMN I think they're probably a good idea in the right person and in the right dose. I do think though, we just had a lecture this weekend that was all about this and it was fascinating about how as you get older, you don't actually lose the ability to make NAD. Like you're actually making as much NAD as you ever were. And if you don't know, NAD is, it's important for cellular energy production. And we have this idea in our heads that if we take things like precursors like Inamin, which David Sinclair made famous, then we can increase NAD, and that's going to be better for, energy production and things. But it turns out that you don't actually make less NAD as you get older. The problem is you break it down faster. So you make the same amount, but you break it down faster. And so some of the newer approaches are actually targeting the breakdown of NAD instead of giving you extra, because if you get too much NAD, and especially if you're older or if you have medical problems like heart disease or things like that, then there's the potential to actually kind of go down these like dangerous pathways with the overflow of the NAD that you're making. And so I think that there's a balance. I think a little NAD precursor is fine. Like, I have NR is in the product that I make, but I think you also want to make sure that you are getting like apigenin, which is going to help to help you get, kind of keep the NAD around longer in a safe way. Or there's a new ingredient that just came out called 1-MNA, which is getting a lot of buzz. It's out of Poland, but that's another one that is probably ultimately safer for like just mass consumption than giving everyone NAD, because it helps prevent the breakdown of NAD, but it's not going to give you too much NAD.
What's the name of your vitamins, your product?
It's called Hopbox, HOP box, which is with that sign hop to it up there. Yeah.
Hopbox.
Hopbox. Yeah. Hop is the company, and then the product is Hopbox. And so it's like a female focused longevity. It has like 19 ingredients, and it's little packs that you just take once a day. It's
I love
super
it.
Easy.
We'll check it out. And anything else that you're doing that we should know about?
Yeah, we just actually today, the press release went out. We just opened a longevity and health optimization clinic in Austin, and we're going to do it. Well, it'll be a whole franchise. This is the first one, but we'll have a few in Austin first, and then we'll kind of go nationwide. That's called Humanaut Health, like astronaut, but with humans. And we'll be doing, all the things that we just talked about here on this hour. We do all those things with patients and try to make it a little easier to bring that access, everywhere, not just for the very high net worth people.
I tell you, Austin, everything's happening in Austin. I mean, you have Elon Musk there, and you have, obviously, people like Joe Rogan are talking about these great topics that you're talking about, and there's a lot of exposure. I just think Austin is a hotspot right now.
It is.
And becoming more and more so. So you're in the right place, obviously.
Yeah.
So keep us posted on what you're doing. This was really so user-friendly and very, very helpful, and we'll all check out Hopbox. And good luck with the longevity clinic. Is it a clinic?
Yeah, it's a clinic. Yeah, we'll have actual clinic. Yes.
Awesome. Well, we're in New York here, so maybe I'll have to take a trip to Austin.
Yeah.
Good music, right? Good.
It is. It's a great place. And we'll eventually make it to New York, but it'll be a little while probably.
All right. Well, we'll stay in touch. And Amy, this was such a treat. Thank you so much. I really appreciate your time, and we'll check out Hopbox.
Thank you so much. This was wonderful.
My fun. Thank you.
Bye-bye.
Bye-bye.